Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Rockville, Maryland, discussing advancements in dental implants and how they can give you a healthy and beautiful smile with one of this area's top dentists, Dr. Sivakumar Srinivasan, otherwise known as Dr. Sreeni. Dr. Sreeni graduated from Boston University Dental School and completed his oral and maxillofacial surgery residency at University of Medicine and Dentistry of New Jersey. Dr. Sreeni is board certified and is a fellow of the American Association of Oral and Maxillofacial Surgeons. Welcome, Dr. Sreeni.
My pleasure being here.
Oh, it's our pleasure to have you on. It's your first time, in fact, on A New Me. And we've got a lot to talk about regarding a very important option that's available that could help so many of us, namely dental implants. So let me begin by asking you to tell us what they are for those of us who may not know.
Sure. Dental implants are the closest we've gotten to nature in replacing either one tooth or multiple teeth. The process is like putting a device into the bone which is shaped like a screw, and then the bone grows into the implant. And that's what makes it successful. I mean, in some ways, this is something that people have aspired to do for centuries. I mean, dates back to 16th and 17th century when they tried stone and ivory to implant it in someone's mouth to see if it'll work.
Oh my goodness, talk about the Stone Age, literally.
Absolutely. It's only more recently, since the 80s, that we've come with the kind of implants that we're using now, which are more predictable and which the body accepts without any issues. I mean, the implants that we use now are similar to the ones that are used in the knees and the hips.
Oh.
The same kind of a metal is called titanium, and the body accepts it very well without any problem.
Let me ask you, Dr. Sreeni, what types of problems do dental implants correct?
What implants have really come to do is to replace missing teeth, be it one tooth or multiple teeth, or they can also be used. I'll give you an example. You're familiar with a lot of people having dentures.
Yes.
And initially when they have the denture fits very well. They have no problems with it. But as time goes on, as the body ages, what actually happens is the bone underneath the denture is constantly resorbing, meaning it's dissolving. And that's why after a period of time, you've heard people say, oh, my dentures are loose. My dentist is not able to fix it anymore. He says, I don't have enough bone.
Exactly.
You've heard that. So what happens in these situations, we as surgeons can go in and put implants in selected spots where there's still bone, and then anchor these dentures onto the implant so they clip on and they won't fall. It actually helps the patient to laugh, smile, and not be afraid that they're going to fall in the middle of a conversation.
My goodness, so talk about a quick way, literally, to regain that smile, to replace missing teeth.
Absolutely.
and suddenly you feel a new me.
Absolutely. And the same thing is also used if, for those unfortunate people who have either in an accident or cancer have lost their eye, nose, or ears. The same technology is used where you could make a prosthetic nose or a ear or an eye, and you can place the implants, and then you can snap on the prosthesis. And that's what holds the prosthesis for many unfortunate who are out there. This technology is very beneficial.
No doubt about it, and another major benefit from technological advancements that have taken place. Let me ask you, you've told us about what dental implants are and certainly what types of problems they correct. I wanted to ask you, Dr. Sreeni, who would you say to the viewers that are watching today would be a good candidate for dental implants and how it could help them?
Anyone who's healthy and who is desirous of improving their ability to eat or the ability to smile, they all qualify to have implants done. The only ones that we need to take some preliminary, like evaluation and speak to their physicians and bring them to an optimum state are those who have diseases of the bone, people who are very poorly controlled, brittle diabetics who have high sugar, And those who recently had radiation to their jaws, or patients who are actively having cancer chemotherapy, are the ones who don't have the ability to heal after a surgical procedure.
So they wouldn't be a good candidate,
They
but
would be a good
others
candidate,
would.
but even in those situations, for example, a poorly controlled diabetic, could be educated. And this could be the reason why now they get in shape. They change their diet because they want to have their teeth, and they exercise, and it motivates them to better control their disease so that they could qualify to have implants.
Well, that's certainly very interesting, Dr. Sreeni. And I wanted to ask you next, what's the typical process that a patient would be looking at if they were to get dental implants?
It all starts with a consultation. They first come into the office for a consultation, and typically they're referred by either a family friend or a dentist, or they look at us on the website, and then that's how they usually come to the office. And when they come in, we bring them into the office, we do an evaluation, we take the appropriate x-rays in the office, and then I take measurements to see if they have enough bone and enough space to put an implant in. That is something which they need to have. If somebody has had a tooth taken out and waited too long, they may not have enough bone for us to put an implant in. So once the consultation ascertains that this person has enough bone to put an implant in, then we educate them about what the implant is all about, how does the procedure work, how do implants differ from a screw in the wall.
Sure.
And we go over anesthesia options, and then we pretty much put a package together of everything that I have verbally discussed with them. We give it to them in writing.
Okay.
And then they come up and meet with the patient care coordinator in the front, who goes over payment options with them. And now they're ready to schedule for the surgery.
And that's it. That's what they're looking at, to find out when they come and have a consult with you, to obviously, as you just eloquently stated, to really do a needs analysis to see if this is something that will benefit them, and it's something that would work for them, and then you go from there.
Right. And everyone who comes here, we give them all the choices, and so that they can be the ones to decide which way they want to go.
Now, Dr. Sreeni, say a patient says, yes, I do want dental implants, and I want to feel better, I want to look better.
Absolutely.
Then as far as the procedure itself goes, they would come back another day from the day of meeting with you initially. Then when they do come in for the procedure, how long of time are we looking at?
An average time for an implant is probably around 45 minutes.
That's it?
It doesn't take long to put
I
an
thought it would be
implant
something that might take several hours, no?
No. If you're doing multiple implants, if I'm taking teeth out and putting implants in, what actually takes me longer is to take the tooth out, not to put the implant in.
My goodness.
Yeah, because we have to take exquisite care to make sure that we preserve the bone. So the extraction sometimes takes me longer time than actually putting the implant in.
That is very interesting. So talk about literally a quick fix. You get 45 minutes or so, and they come in missing teeth, and they leave with a beautiful smile and full mouth of teeth.
And the other thing is the implants, some people think, oh my God, something going to my bone, is it going to be painful? There's a question people have in their mind. Mm-hmm. The answer to that, it is not painful. Unlike teeth have nerves and blood vessels and everything else, bone doesn't have as much of an innervation as teeth and gums do. So my implant patients, even though I prescribe them heavy-duty pain medications, most of them tell me that they didn't need to take any of the strong pain medicines. They just take some mild pain medicines, and almost all my implant patients go to work the next day. And a few of my implant patients who've had the procedure done under local anesthesia, they even go to work the same day.
My goodness, so there's virtually little to no downtime at all.
No downtime.
Now, what type of results can we expect from dental implants, doctor?
The results are really phenomenal. I say this only because in all the years that I've been doing implants, very few times that I have to bring a patient back and take an implant out and put an implant back in. The success rate of the implants are in the high 90th percentile.
Very high indeed.
Very high, very high. And as long as the patient follows some very easy instructions that we give them following the surgery with regard to diet and things like that, they should do just fine.
Well, speaking of results, I believe you have some patient before and after pictures you'd like to show us.
Absolutely.
Let's take a look.
This patient came to me from her dentist. She had had dental work done back in her country, and she was very concerned that the bridge was all moving, And she went to her dentist. He took x-rays and looked at them and said, these teeth are not going to be possible to save. So he sent the patient over to me to see what I could do. I examined her, took x-rays on her, and confirmed that these teeth were not going to be able to be saved, and decided to remove those teeth and put implants and restore her smile and confidence. The picture that you're looking at here is an x-ray to show you that the bridge is failing. And the second picture is a picture of her mouth, and you can actually see the roots beneath the crowns. And the third picture is after I've removed the bridge, you can see all that is left behind are the roots that were barely supporting the bridge. And then you see the implants are already placed. Now I'm getting ready to take impression of the mouth with the newly placed implants. And finally, I put some healing caps in her mouth. She goes home, comes back the next day, and I inserted the temporary bridge in her mouth. You can appreciate the big smile she's giving us because she's so happy and ecstatic that she has teeth back in her mouth that don't need to be removed. There's another patient with just one tooth. She had had a root canal in this tooth in the front and had a crown placed, and the tooth had actually fractured. Her dentist said there's no way he could save the tooth. Patient came to my office, and this is the pre-op pictures that you're looking at. And I went ahead, took the tooth out, and then placed an implant in, and the very next day gave her a temporary that she was very comfortable and happy with.
Some very impressive work, Dr. Sreeni. I am really amazed at the results that we just saw, because you're looking at people in some of these pictures that either had no teeth or bad teeth or broken teeth, missing teeth, and you look at the after picture and they've got a beautiful smile, beautiful
incredible.
White teeth, and they have to feel like a new person.
Absolutely. It makes a big difference for them, for their self-image. We have some patients who practically who actually hug every one of us before they leave.
Well, you changed their lives, Dr. Sreeni, and I can certainly understand and see all that from here, talking with you today. Now, I wanted to ask you, Dr. Sreeni, from the pictures, obviously there were problems with people's teeth that were in the front of the mouth, and obviously the great work that was done to give them a new smile. But what about for folks who are watching that have problems with those big teeth in the back? Can dental implants help them as well?
It's a great question. In fact, recently, about a year and a half ago, the FDA approved something called the Max implant. And this has transformed the way we've treated the teeth at the back. Traditionally, we would remove the tooth, would put bone graft in and have the patient come back about 4 months later. And that typically works fairly good in the bottom jaw, but in the upper jaw, there are some problems, and that is, even during the 4 months, the sinus begins to grow into the area where the tooth came out from, leaving very little room to do an implant. So inevitably, when the patient comes back 4 months later, we're looking at an x-ray and saying, uh-oh, you don't have enough room, your sinuses are too close, we now need to do a sinus lift. And that's another surgical procedure. Now, we have the technology to avoid all this. By putting an implant in the same day, we take a molar tooth out. And this is something amazing that's happened in the field.
Well, that's another advancement that's
Absolutely.
benefiting so many.
If you'll allow me, I would love to show you a video clip of that so you can really appreciate how this process is done.
Well, we can take a look at it right now.
The procedure is begun by horizontally sectioning the crown of the first maxillary molar, then atraumatically removing its roots. Part of the intraradicular bone is then removed and the roots degranulated. Utilizing a round burr followed by the 2 mm diameter pilot drill, the osteotomy is initiated by drilling in the remaining intraradicular bone. Using an in and out motion, with each motion lasting 1 to 2 seconds at 1000 to 2000 RPM, drill to the required depth of the selected implant. The osteotomy site is further widened with a 3 mm diameter pilot drill to the required depth of the selected implant. At this point, the osteotomy site is widened using a 6 mm diameter by 8.5 mm length tapered drill to the full depth of 8.5 mm. The final implant drill, which is slightly smaller than the max implant selected, is then used at a speed of approximately 300 to 800 RPM to provide the final shape of the osteotomy. The max dental implant is then carefully removed from its sterile vial with the pre-attached fixture mount and is carried to the osteotomy site where it is inserted at 15 to 20 RPM and 30 to 35 Newton centimeters.
Dr. Sreeni, what about folks out there who have no teeth whatsoever? I mean, nothing but gums basically, or who are very unhappy with their dentures and things along those lines. Can dental implants help them as well?
Absolutely, absolutely. In the very beginning, we talked about how we could put some implants to hook the dentures onto them. That option is there, but there are also a set of people who've tried the dentures who just can't stand them. They can't. Psychologically, it's a problem, and physically also, they somehow feel that the teeth are not fitting right.
Yes.
The options are available where we can put multiple implants in their mouth, and then we can design teeth which are actually permanently fixed onto the implants, so they never need to remove.
That's certainly very good to know.
Absolutely, and technology is also available, and I'll be happy to show you a case where we have brought a patient in, taken a CT scan, and then from the CT scan designed the whole implant on the computer, placed the implants, and we were able to see where the sinuses are, where the nerve is, and we put all the implants, and then we sent this file, the DICOM file, to Sweden. And in Sweden, based on what we had done on the computer, they prepared a hard model in plastic, and then they sent, it's a surgical model, or what we call as a surgical template, and they sent it over to us. And based on the surgical template, this is almost incredible.
Talk about advancements from technology. We've come a long way, Dr. Sreeni.
We have, and based on that, they fabricate the teeth ahead of time before we even put the implants in the patient.
How long do these results typically last, doctor?
Well, the good news is the patients who had the implants placed in the early 80s, they still have them.
28 years later?
Yeah.
My goodness.
So I usually tell my patients that the implant will outlast you or outlive you.
Well, that is very impressive.
I also tell them that if an implant that I have placed, for whatever reason, fails, all they need to do is come back into the office and I'll replace it for them at no cost.
Well, that's very good to know, Dr. Sreeni, and it talks about the eternal lifespan of these implants, it sounds like.
Because most people are paying from their pocket for an implant, and I just want them to know at the very beginning that this is something that's going to last them a long time.
Yes. I wanted to ask you, Dr. Sreeni, are these dental implants covered by insurance?
These implants last longer than what they have traditionally been covering. They traditionally cover for bridges and other things which typically need to be redone over a period of time. So now they have finally gotten the message. So insurance companies have begun to cover for the procedure, some completely, some partially, but they have begun to. So at least some of the major insurance companies have begun to do that.
Well, that's certainly good to know. And like you said, you made a great point. Bridges and other dental work that we occasionally have done, you're right, that's for the shelf life of that work is for a finite, limited amount of time, whereas based on what you told us here today, dental implants can outlast us.
Absolutely.
So it makes sense from that perspective as well for an insurance company to cover dental implants.
Makes great sense.
Are there any follow-up visits required, Dr. Sreeni, after one has the dental implant procedure done?
Yes, they come back 2 weeks later for me to take a look to make sure they're healing right. And at that time, if I had placed a stitch, I do take the stitch out at that time. Okay. And then they do come back again to see me, depending on the quality of bone, anywhere from 2 to 4 months, for one final check before they go to see their dentist to have the tooth placed on top of the implant. At that visit, I take an x-ray and make sure that the implant has become part of their body, and then I send them to their dentist.
Wow.
And I also like to see them once after they had the permanent crown placed, typically a month after the permanent crown is placed, and then I encourage them to come here once a year to have an x-ray done for me to take a look to make sure it's good. But they also need to follow up with their dentist for periodic, just like they have their teeth cleaned, they also get the implants cleaned. They just use some special scalers for it, but they do need to do that.
Well, that's very interesting indeed. Now, I wanted to ask you, doctor, are there any alternatives to implants that are out there for us to know about?
Sure. The alternatives are the ones that have been there for a while. One is the removable prosthesis that are called a removable bridge or a partial denture. something that the patient would put in the morning and take out at night. They also have a choice of doing a bridge, but one thing for the bridge is they do need to have teeth on either side. And then the dentist would basically cut down the protective covering of the tooth behind and the front, and then make crowns that will go on top of those. I personally don't like that option because you're destroying good tooth structure in order to replace a tooth that can easily be replaced with an implant without touching the teeth. So I think an implant is a better option. And the other problem with the bridges is they don't have a longevity. What happens over a period of time, the patient finds it difficult to keep things clean underneath the crowns, and they could develop decay, and then they may end up needing to get new crowns and root canals and all of that added things. The other choice they have is to do nothing, not to replace the tooth. It's not a great option because in quite many people, the neighboring teeth will begin to shift into that space where the tooth came out from, and typically nature designed everything to fit perfectly well. And when you have teeth shifting, food gets stuck in and the bite is not proper anymore. So it's not a great option not to replace a tooth.
Yes, no, based on what you've told us here today about dental implants, it's definitely the cutting edge way to go.
Absolutely.
To get that confidence back, to get that new smile back, to replace missing teeth.
And it's also more affordable in the long run. If you really look at it, when you look at other alternatives to implants and the number of times they need to be redone over a period of time, we could just choose to go with an implant, and there's not that much money that needs to be spent over the course of the years to come, because the implants typically do last a long, long time.
That's right. They'll even outlast us in many cases, as you said earlier. Now, we've only got a few moments left, Dr. Sreeni, and I wanted to touch another topic with you, and that is that you and your organization have developed an esteemed reputation when it comes to patient dental care. And I wanted to ask you, what separates you and your organization apart from the many others?
That brings us to why I started this practice. In 2002, when we opened this practice, the whole idea behind it was I wanted to set up a practice where we offer care like that was being done here years ago, personalized care. I didn't want to have a large volume practice. I'm a low volume practitioner, but we take enormous amount of time with our patients. Every patient is unique and every patient is special to us. And I'm very thankful to my staff and to all the dentists who refer their patients to us, who trust their patients under our care, because the way we take care of them here is like we like to be taken care of ourselves. We spend a lot of time with our patients, give them a lot of choices. There's nothing that they have to. We educate them and let them decide which way they want to go.
That's right.
But whatever is the ideal fit for the patient is what we end up using. And that makes a difference. Plus, I stay up with technology, and I go for all the conferences. So I bring in technology to the office, and that's how we've been able to do a lot of these immediate restorations. Because we use the most ideal implant in that location, which will enable us to sometimes put a temporary tooth on, and that makes a big difference. It brings a big smile onto the patient's face.
Yes, indeed. And lastly, you're very community-oriented and focused, Dr. Sreeni. We've found that you've helped so many folks from underprivileged people who cannot afford dental care with your charitable work that and what you've given back to the community in helping, obviously dental clinics that are in the area that, again, help folks that basically don't have the money to even go to a dentist for a checkup or a visit.
Absolutely. I think the biggest growth of an individual is when you give without any expectations.
Yes.
And I'm thankful to Montgomery County for allowing me to do that on a bi-weekly basis at the community clinic in Colesville.
Yes. Well, on that note, I'd like to thank you, Dr. Sreeni. This was a very helpful and informative interview today, and thank you again for joining us and being a guest on A New Me. We'd love to have you back in the future.
Great. I thank you and your crew for giving me the opportunity.